Hello, welcome to Adapt NCLEX. Today I will be talking about the peripheral artery disease and peripheral venous disease. Here to just make it easy for you so that when you see something like that, you'll be able to answer it very quickly without any problem. We will start with the peripheral artery disease, so PAD. In actual fact, peripheral artery disease include any portion of your body that contain an artery that is outside your heart. But unfortunately, your exams is only focused on a disease process that goes to your leg. So when they ask you about peripheral artery disease, they're referring to arteries going into your leg. And so this, I will just draw an example. This is the aorta coming down, and it has branches called common iliac. So this is the iliac vessels. And these iliac vessels branches into a left internal and an external iliacs. It is popliteal, then it branches. You don't have to know the names, but you can see you have an artery that is going down to all the way from your heart down into the abdomen, into your leg. Unfortunately, these arteries can go into trouble. You can have plaques building up in these arteries because of cholesterol problem. And that's number one risk factors. So you have a risk factor here leading to peripheral artery disease. So you have cholesterol problem leading to plaques. So you develop plaques all over, and then that impede blood flow in these vessels. That's why it's called peripheral artery disease. You have this plaque building up. Then you can have diabetes. Diabetes, because of high sugar level, they can cause inflammation that can make these arteries very thickened and stiff that they cannot open up well. And it also causes obstruction. So you have diabetes here causing thickening of the vessel due to inflammatory effect of high glucose. So this causes the plaque, and this is the inflammation from glucose. In the second risk factor you can see is hypertension. So when your blood pressure is very high, you have high systemic vascular resistance. So that make this artery really stiff. They hold the artery, the pressure in it, and they become thickened and they become dysfunctional. And that is a risk factor for peripheral artery disease. So we have cholesterol, diabetes, hypertension, all these affecting the vessels. And another issue most people don't know is smoking. Nicotine in smoke causes inflammatory effect, and it causes an inflammation. It causes excessive vasoconstriction, and then that make blood flow through the leg really not perfect. And so that's another risk factor. And of course, age is also a problem, age greater than 70 years. So as you can see, these are risk factors the examiner can ask you easily as a SATA question. You have cholesterol, high cholesterol, diabetes, hypertension, smoking, and age. Cholesterol leading to plaques, diabetes, inflammation because of the glucose, hypertension causing high systemic vascular resistance, smoking because of the nicotine causes vasoconstriction, making the vessels so thick and then constricted, that blood flow is diminished, and age greater than 70. As you get older, your vessels doesn't work anymore. So these are risk factors for peripheral artery disease. You expect the board to ask you this. I mean, you don't have to memorize it, but you can think about it, how this can happen easily, and it causes changes in the vessel. In this vessel that is all thickened with cholesterol plaques, less blood flow, all the smoking, everything is thickened. These are symptoms, okay? How the patient present when signs and symptoms when he's walking around. Usually they will, when you walk around, there'll be ischemia, blood flow going to the leg is very small. So as they walk, they will have pain and they will stop. So that is what pain and with walking usually at the calf, and then they will stop. And so that's what we call claudication. They will have claudication. What you tell this patient is to continue walking. As they walk, more blood flow and will cause increased blood flow, and that will help with their claudication. So pain with walking at the calf is one of the symptoms that they will complain about, and that is claudication. They can also have pain at rest. When you see pain at rest, that's really bad. Claudication is okay, but pain at rest, that means blood is not even flowing without them not walking. And so if you don't walking and you're not walking and you have pain, that means it's really bad. Your peripheral artery disease is bad. So think about it. Blood is very warm. If blood doesn't go to your legs, what happens to your leg? Your leg is going to get cold. So you expect the leg to be cold for peripheral artery and artery disease, PAD. So if no blood is flowing and your leg are cold, your skin, what do you think is going to be? They're going to be shiny and very thin. So they're going to be really, really shiny and very thin because of less blood going through the skin. And usually they will describe it as atrophic skin due to less blood flow going to the leg. And if there's less blood flow and your skin is cold and it's shiny, you're going to lose air because the air is going to be tiny and they can't get enough blood to grow. So you will lose most of your air in your legs, and there will be nothing there as if you've shaved your leg, but it's because there's less blood flow going. In the same thing, this is all pathophysiology. If there's less blood flow going to your leg, if you have a wound there, it's not going to heal. Wound healing issue, because most of the nutrient in your blood cannot go into your leg to heal that wound. You should expect their pulses to be weak. So pulses will be weak or absent. This is all expected finding when somebody has peripheral artery disease, because there's no blood. The amount of blood going to the leg is not going to be a bounding force. So pulse. So it may be like +1 pulse is normal for them. And because there is less blood flow, and they can injure themselves easily, and they will develop ulceration. And remember, this is peripheral artery. Most of these ulceration is good to the distal portion of the leg. So usually at the toe, mostly they have ulceration at the toes. And don't be surprised if you see blue toes and gangrene. So when you see gangrene, this is also, it's a normal finding. The nails, the same thing using the pathophysiology, they were going to have a brittle nails, very tiny nails. And your skin is going to be really dry. Dry skin. All this is from the pathophysiology of decreased blood flow. If less blood flow, then sensation is going to be diminished. And you can use this to teach these patients, because there's decrease in sensation. Education for this particular patient is what? Well, make sure you don't wear shoes that is too tight, because you can feel your legs. Okay, make sure you take care of your legs so that it doesn't cause injury. So cover your leg when you're wearing your leg. You don't, make sure you don't expose your leg. Make sure you don't wear sandals. You wear shoes that is not too tight. And then, because if you injure yourself, it's not going to heal. Don't put any heat on your legs because you're not going to feel it because you have lost sensation. There's less blood flow. And so this is the education. You can see how they can ask you certain questions on that. So this is what you tell the patient. And because there's less blood flow going to the leg, when they raise their leg up, there's the blood flow is going to be less. And so there's something they call polar on elevation. When you elevate their extremities, the leg become wide, so it's become polar. But then when you put the leg down, it become what we call dependent rubber, because when you put the leg down, more blood flows, so the leg become red. So it's called dependent rubber. Rubber means hot and red. And then elevation with power. That means the leg become white. So when you elevate the leg, it become white. They become more ischemic. But when we put the leg down, they develop dependent rubber. So most of the time, you tell them to dangle their leg because there's more blood flow when they wake up. So they shouldn't elevate their legs. And of course, you got to teach them based on the risk factors we talk about. The risk factors is they need to avoid smoking. They need to make sure their blood pressure is okay. They need to make sure their cholesterol is okay. They have to control their diabetes. They have to lower their salt intake. You see, all this thing is based on the risk factors. So that's your education that you're giving to the patient. They have to take antiplatelets to increase blood flow into the legs. The common medication they use is pentoxifylline, and that's what they use to increase blood flow to the leg. They have to take care of their legs carefully. And these are all some of the things you can tell them, and they can ask you like a sort of question. And then it's straightforward. Based on the pathophysiology, you get a risk factors, and the risk factors, you can educate them on the risk factors. And because of the pathophysiology, you expect some of the decreased blood flow. Every symptoms is related to decreased blood flow, and you can educate them about what they need to do. Now, we go back to the venous disease, peripheral venous disease. Remember, in your leg, the same thing, the artery follows the vein, and the veins take blood to the heart. But the veins have what we call valves, and these valves allow blood to flow in one direction. Valves, so blood, when blood is flowing, is retaining blood, it goes this direction. You don't want the valves to point down. When the valve points down like that, they become what we call reflux. And then we have blood pooling in the legs, making the vein varicose, so tortuous and dilated. And you can see it on their skin. And that is what causes peripheral venous disease. So you have blood pulling into the vein, and instead of going to the heart, it's staying in the lower extremities and causing edema. And therefore, so based on the decrease in return of blood, you can see that these patients who have specific symptoms, you have edema from blood pooling, and this edema will cause the leg to swell. And usually it's both legs. And because the blood is venous blood that stay in the legs, when it stay there, it causes pigmentation of the legs. And because of the pigmentation, the hemoglobin in the blood, you see brownish pigmentation of the skin. But because the blood is staying there, we call it stasis. And they will develop ulcer from venous stasis. So they have stasis ulceration. This ulcer is very specific. It occurs in the medial aspect of the leg, of the ankle. So medial stasis ulceration. But remember, because the blood is not going, it's staying in the leg. So instead of the leg being cold, this one is warm. It's warm leg or foot. Because of the edema, the skin is going to be very thick skin compared to the artery where they have a tiny skin. And as you can see, these people will feel much better if they elevate their legs to allow return of blood back into their heart. And therefore, these are signs and symptoms you should know about in the peripheral venous disease. It's straightforward. And you can see the risk factors. Patients who have varicose vein, patients who have venous insufficiency or vein that is refluxing, or if you stand for a long time, blood will pool in your leg. Pregnancy is also another risk factors. With all the fluid going to your leg, it will cause that. If you have DVT before, it make the vein incompetent, and then the refluxes, and you can develop peripheral venous disease. So these are signs and symptoms of peripheral venous disease. And so you can tell the patient, educate them not to just stay on their feet for a long time, elevate their legs, and then use compression to push the graduated compression to put the blood back to the heart. So they can, these are the people you need a graduated compression stockings. And remember to wear the stockings, you got to put it on before you get out of bed, before you allow the blood to pool in your leg. So we're going to do a few questions. What statement by the client indicate a priority need for the follow-up teaching? So a client with peripheral artery disease is visiting the healthcare clinic. The nurse complete a health assessment. Which statement by the client indicate a priority need for a follow-up? So you need a follow-up teaching, a priority, patient with a PAD. Don't confuse it with the PVD. So you know all the symptoms. I always take my simvastatin in the evening. This is true, but it's not a priority. Patients who have cholesterol problem take their cholesterol medication in the evening because you make more cholesterol, you synthesize cholesterol in the evening, so it does not need further teaching. So this is correct. I prop my leg up in the recliner and uses a heating pad when my feet are cold. So there's two things here. You're not supposed to prop your leg collar on elevation and dependent rover. They're supposed to dangle their feet rather than raising it up, and they shouldn't put any heating pad on their leg because they cannot feel it. So this is neat teaching. I have been walking on a treadmill at home for 15 minutes each day. This is to improve the claudication, so this is good. I've noticed that I don't have much air on my lower leg anymore. This is expected because of the ischemia of the leg, so they have little air on their leg. So this is an expected finding, and therefore our correct answer is number 2. What is the priority assessment should the nurse perform? So you have an elderly client tell you, I have experienced leg pain several weeks when I walk in the mailbox each afternoon, but it goes away once I stop walking. What is your priority? You have to read the question again and see what it's describing. Patients say you walk several miles to the mailbox and get pain. Once I stop walking, a claudication. So this patient should be taught to continue to walk past where he's getting the pain. What do you need to tell this patient? The priority assessment is to assess their peripheral vascular disease. So assess for dry, scaly skin on the lower extremities. This is an expected for a PAD. So it's not a priority. Assess for presence or absence of air on the lower extremities. This is what you expected in a PAD, but it's not a priority. Check for presence and the quality of the posterior tibia and dorsal pulses. You really want to know their pulses to see how bad their disease is. That's a priority. And then, like I said, in my priority assessment, be sharp, not expected. So obtain a dietary history is expected. Let me go to the next question. The next is assessing a client with a possible diagnosis of peripheral artery disease. Which client statement is consistent with the diagnosis? So we are looking for possible diagnosis of PAD. Which one is consistent? Don't confuse it with the PVD, okay? At the end of the day, my shoes and socks are tight. This is like a demon, so this is PVD. I have a slow healing ulcer right above my ankle. This is, you remember I told you the ulcers of the PVD is usually medial and is on the lower extremities. The ulcers of the PAD is at the tip of, so at the great toe. So this is PVD. My leg ache when I stand for a extended period of time. This is blood pooling, so this is PVD. When I sit down for rest and elevate my leg, the pain increases. So polar on elevation. So this is PAD, number 4. So this is the last but one question. For SATA, it's true and false. So you got to make a decision, read it, make sure it satisfies what you've been given. So a nurse is reviewing a discharge instruction on a home management of a patient with a PAD. So your key word is PAD. Which statement indicate correct understanding? So correct understanding. So I have 2 things. Every answer should satisfy PAD and it should also satisfy correct understanding. I will apply a moisturizing lotion on my legs every day. This is a correct understanding. It's good to keep your leg with the lotion because of the dry skin, to keep it moist. I will elevate my leg at night when I'm sleeping. Remember, I told you polar and elevation and dependent robot is better. So if you elevate your leg, your pain is going to get worse. You better to dangle your feet. So this is wrong. I will keep my leg below heart level when sitting. This is good. Dependent robot. It's called dependent robot. So this is correct. I will start walking outside my neighborhood. So this is to improve the claudication. You know, walking is good for these patients. I will use a heating pad to promote circulation. They have decreased blood flow. This is a tricky one. You know, a heat will improve circulation, but these people cannot feel their legs at all. So if they put heating pad, it causes injury. So this is wrong. And therefore, the right answers are 1, 3, and 4. So next question. Then we're done. The same SATA question. You read it, make sure each answer satisfies the keywords, and you make a decision. Don't leave it until you make a decision. If you do that, then you start comparing answers. Don't do that. The next, identify which of the following risk factors. So we're looking for risk factors contributing to peripheral artery disease, PAD. So we talk about based on the disease process, you have cholesterol, blocking it. You have tobacco causes vasoconstriction. You have diabetes, also making the artery very stiff. You have hypertension, making the systemic vascular resistance. So those are all the risk factors that you should worry about. So you have smoking as an answer, diabetes, hyperlipidemia, birth control causes DVT, and it makes the vein incompetent, and it causes peripheral vascular venous disease. And prolonged standing also lead to PVD, and therefore the venous disease is this oral contraception and prolonged standing. So this is the end of it. But as you can see, these are straightforward questions. They are easy. You just have to stay within your lane and use the pathophysiology for the disease process. If it's a venous, it's because of venous incompetence. And so blood pooling. So blood is too much blood in the lower extremities. If it's arterial, there's less blood. So using that pathophysiology, you can come up with all the signs and symptoms. You don't even have to memorize it.